I have the pleasure of talking to you about secure food supply plans overall. We'll talk a little bit about the components that you'll find in each of those, a little bit about the HPAI secure food supply plans, as well as the FMD plans. And then the last few minutes, I'm going to focus specifically on the secure beef project. So once a foreign animal disease is diagnosed, you're probably familiar with the 10-kilometer circle. We've heard a lot about that today. I guess the biggest thing to take home from this is that the secure food supply plans work on the farms that are affected by the control area, but not infected by the disease. And so we talk about monitored premises, so I want to spend just a little bit of time on that. So the secure food supply plans are for monitored premises, which means they're not infected, they're not a contact, and they're not a suspect premises. So when we talk about monitored premises, in order to fulfill their permitting needs, there are certain things that need to be followed, a set of criteria. So again, the person accepting the product needs to want it, right? Whether that's within the control area or outside of it. A permit is then requested, and then in order to approve that permit, then instant command, either USDA or state animal health officials need to make sure that certain things are happening. So is surveillance being done on the farm of question? What testing is being done? And what do we accept as far as test results? What are the biosecurity plans that are in place? And then what is the risk assessment around that particular movement? And so again, these are the pieces of the puzzle that have to be fulfilled for those monitored premises. And this is where the secure food supply plans pick up. So once that disease is diagnosed, the red book comes out for all the infected, contact, suspect premises. But the secure food supply plans are focused on those monitored premises. Again, they're affected by controls, not infected by disease. So business continuity is really what they're aimed at. Where can we help these producers still receive a paycheck for their safe and wholesome food products and continue to produce quality proteins for our consuming public? So this morning in Dr. Ross' presentations, talked about what are the goals of the secure food supply plans. And if you held up the FMD Red Book or the HPAI Red Book, there's a lot of alignment. That very first bullet is not different, right? We want to detect, contain, and control a disease as quickly as possible, avoid interruptions, and maintain that safe and wholesome food supply. Again, business continuity. So it's sometimes confusing for people that have heard about secure food supply plans and how do they relate. We're helping those monitored premises, again, maintain business continuity. So again, you can find these resources on the APHIS site or our center site. So what is business continuity planning? I sat in a lecture this morning on the equine industry. I never really thought about it. But they don't get indemnity when EHV hits or pyroplasmosis hits and they have to be euthanized. They don't get indemnity. And I'd never, coming from the livestock industry, I'd never really processed that before. And so when we think about it for our beef operations, our poultry operations, our dairy operations, we're trying to minimize those unintended negative consequences of controlling or eradicating the disease without controlling and eradicating our industry. So it's a fine balance. Risk-based solutions, we know what we know today as far as science and technology goes with diagnostic testing, but we've got to meet both our state-by-state standards, right? Because that state has to want to accept that product coming out of a control area from a monitored premises, and then the trade side of things, our international partners. So what are some of the common components? The theme of this meeting obviously is biosecurity, but a lot of what we look at for secure food supply, it's voluntary. It's a voluntary program. Producers can decide ahead of time as to how much they want to voluntarily prepare for ahead of time. Looking at biosecurity, that is a lot of preparedness, as we heard. Surveillance is obviously during an outbreak, filling out those epidemiology questionnaires, permit guidance, risk assessments. There's a lot of components of the secure food supply plans, whether it's on the poultry side of things or the meat producing side of things for pork and beef. I want to point out that all of this has been funded to date by USDA's National Preparedness and Incident Coordination Center. So Dr. John Zach and his group have believed in this for a lot of years, and we'll kind of show you some of that history. So if you ever get asked the question, what came first, the chicken or the egg? Eggs. So being in Iowa, we just heard from Mark and the devastation that affected, but the original plan was if we had it in Iowa, if we had HPAI in Iowa, the whole state would be a control area. And they said, whoa, wait a second, you will cripple our business, right? There was one place that produced all of the eggs for McDonald's west of Mississippi River. Okay, so you pull up to McDonald's in San Francisco and you can't get an Egg McMuffin. You want to talk about road rage, right? So they knew that McDonald's wouldn't go unfulfilled with their needs. They would just switch their contracts. And then all of a sudden, how do you get that contract back? And so that's kind of where this discussion started, was industry saying, look, our businesses are different. And so we really looked at how will they be affected and what can those control areas look like. So secure egg supply, secure turkey supply, and secure broiler supply all have different movement components related to them. And they're kind of under one umbrella now, secure poultry supply plans. So you've ever heard of the silo effect? People working on certain things and maybe not talking so well. And so we did have the opportunity to build these 3 plans with a lot of communication in between. But for our state animal health officials making decisions, they didn't want different recommendations coming out of these. So the Secure Poultry Supply Plan is kind of the title of these 3 groups, really aimed at the same focus. Business continuity for affected farms that are not infected, and what are some of the standardization procedures we can put in place when it comes to surveillance and biosecurity, so that when people are looking at permits, they're looking at consistent information across the industries. Then we have what we call the FMD plans plus. Our lovely friends in the pork industry get to deal with classical swine fever and African swine fever as well. But again, these are all focused on FMD. And so movement of milk was one of the first FMD preparedness plans, started back in 2009. But again, there's an animal component to all of these because that's how those businesses function. And so just want to point out too that although USDA has funded a lot of this, National Pork Board has funded a portion of secure pork supply over time as well. So when we talk about managed movement, what does that mean? So in days of old, we used to say stop movement. And now from a monitored premises, you're in a control area, we want to talk about managed movement. Today, peacetime, right? There's extensive movement. And in talking with state animal health officials, just saying, do you know how much stuff moves through your state? Well, no, we don't, right? We have interstates and we have we don't know what moves through necessarily. We know what comes in, but we don't know what moves through. And so when we think about what would stop movement do, we know that there's a lot of consequences to that. And so when we think about products and things coming off of a monitored premises, eggs coming off and things going to an end result. So going to processing, turkeys going to market, pigs going to market. That final processing, this is where the secure food supply plans are looking at those movements to determine, well, what are the risks? What are some of the decisions that have to be made? And are some of those decisions too costly from a disease spread standpoint? So again, all of these topics are being looked at with secure food supply plans. So from an HPAI perspective, eggs, turkeys, and broilers have been in different phases of development. We've heard a lot today about the 2015 and 2016 outbreaks, and it was mentioned this morning that the secure food supply plans made a difference. We saw the egg price at the bottom of the last gentleman's presentation. The farms that didn't succumb to HPAI financially benefited. I mean, there was a big paycheck for a lot of those farms that stayed negative. Because supply and demand, right? People didn't go off eating eggs, thankfully. And so the ones that stayed in business profited, essentially. And so can they take that and turn that into better prevention in the future? And a lot of them have, and that's been an interesting conversation. But when we look at HPAI, the response is stamping out. That's it. There's no vaccinate to live, vaccinate to slaughter, and all that. That's the response. And so the secure egg supply plans are very much looking at those farms that are not infected but affected. They each have their own websites, so you can find information there on secure egg, turkey, or broiler, and very similar components across all of those. A lot of information went into pre-event risk assessments, which were utilized during the secure egg supply plan. They looked at what is the risk of moving pasteurized liquid egg, non-pasteurized liquid egg, hatching eggs, day-old chicks. What are the risks involved with that? So it was really good information when people were making decisions. The list is long, but when you think about what was utilized consistently in this last outbreak, those are the bolded spots. Okay, so surveillance was heavily relied upon. PCR testing, state animal health officials agreed that 11 dead birds pooled samples out of 50 from each house. Those results were valid to them. The confidence level was high enough that there wasn't high-path avian influenza in that product. And so, again, there was a lot of resources utilized out of those plans. It was mentioned this morning in Dr. Roth's talk about the resources that were developed. So poultrybiosecurity.org has a lot of resources available in both English and Spanish to help change this mindset, this culture of biosecurity. So again, resources available. This was mentioned again this morning, is that Poultry Biosecurity Information Manual. So like Mark standing up here, what tools does he need? Dr. McCluskey mentioned the HACCP approach, right? You first have to identify your hazards, and then it has to be a culture and continual monitoring, and that's the role of that biosecurity officer. So the officer manual goes through in more detail ways to meet the checklist, the self-assessment checklist. Training is a big component, so trying to provide those resources so that it can be carried out on farm. One of our team members at the center, her hometown paper, Wright County, Iowa, she sent us in a little thing and she said, look, this particular poultry company is actually looking to hire a biosecurity officer, that they want that position at certain, one of their operations that didn't have it in the past. And so I think we're just slowly getting out that this is something that is definitely beneficial to a company. All right, switching gears, our foot and mouth disease response plan. So looking at milk, pork, and beef. So familiar with the red book on FMD. There's a lot of details in there. I guess the biggest take-home message is we have 5 different response options for FMD. Right, we can do exactly what the poultry industry did and focus on stamping out with emergency vaccination, which may be, vaccinate to kill, vaccinate to slaughter, vaccinate to live, and then a pure vaccinate to live strategy. So again, we have different options, and it's a different disease, and it affects more different species. So we'll talk a little bit more about that. So when we started working on these, it's really hard to hypothesize the what-if situations. And so we understand that there are different phases of an outbreak, and there are different types of an outbreak. So this phases and types document was developed a few years back. It's available on our website as well as the USDA's website. But what it really looks at is what is the magnitude of this particular outbreak? Where is it located? How far-reaching is it? And some of the characteristics. There's 7 different serotypes. Some may only affect one species, right? That's going to be a different response than something that affects multiple. So I'm a visual learner. So this is kind of what the phases look like. And so if we get it in Canada or Mexico, it would put us on heightened alert, don't you think? So we don't have it yet in the United States, but our business practices may change considerably. Phase 1 is from the time it's confirmed in the U.S. until we have reasonable evidence to kind of estimate how bad is this? What is the extent of this outbreak? Again, phase 2, we're in an outbreak. That's where the surveillance and epidemiology needs to go to figure out, what support is needed. Recovery is phase 3. And then finally, phase 4 is when we're declared free. How long is this? Producers often ask me. I don't know, right? Different countries deal with this outbreak very differently. We have a very extensive animal agricultural industry with extensive movement. We could go, quickly to phase 3 if it hit in a tiny little corner of a state that doesn't have much. right? And there's not a lot of movement, but we could be in phase 2 for a really long time if it's an extensive outbreak. So let's look at the different types of an FMD outbreak. Type 1 is a focal outbreak, which might be that tiny little corner of a state that, it just happens to hit there and it's in that species and there's not a lot of movement. The approach there is stamping out. And we talked about that this morning. A question came out of the audience about, I thought we were still stamping out. Yes, 100% still stamping out. But if we get into a larger outbreak, like a type 4, which is a widespread or a national, you saw the challenges of disposing of dead chickens that are this big, right? Think of a feed yard, it was brought up this morning, 50,000 head in the Texas Panhandle. You can't dig a trench big enough. And if landfills don't want little dead birds that only affect birds, they're not going to want dead cattle and dead pigs, right? So again, the disposal options preclude our decision to put bullets in the head of these cattle or these pigs. And so when we get to these different types of an outbreak, that's when our mindset has to change. And above all, foot and mouth disease is not a public health or a food safety concern, right? Our exports are affected, but there are still people in this country that want to eat it and drink it and have it in their coffee. And so this is really what's kind of helped shape some of the secure food supply decisions, is depends on what type we're in. Different response strategies will come forth. Okay, so that was the 25,000-foot view of the secure food supply plans and kind of how they're overlapping. We don't have a website up for secure beef supply, but that's on our task list for this year. So we're in the planning phases of what content that will have. So this was funded by USDA's APHIS cattle health programs, just starting a little over a year ago in October of 2014. Again, it's a private-public partnership, right? We have industry, we have state, we have federal, and we have academic partners. It's a voluntary program, as are all of the secure food supply plans. The initial goals are to develop biosecurity performance standards and surveillance plans for feedlots, transporters, and packer processors. The initial piece of this puzzle that we're trying to take is finished cattle to processing, right? That's the initial focus of secure beef supply plans. We recognize there are a whole lot of other pieces of the of the beef industry, but that's one of the first movements. And so, again, FMD is not a public health or food safety concern, so if we can get those animals to processing in a timely manner, that's still a safe protein as long as they pass ante and postmortem FSIS inspection. So we've got 6 different working groups tackling different topics when it comes to the secure beef supply plan. Obviously, biosecurity and surveillance. Communications is huge. I took to heart what Mark said a little bit ago about, I wished our community knew more about what our industry was like, right? The industry knows each other very well, and you might walk into a local Casey's, which for Midwesterners, we all know what Casey's is, right? And that's a place to share information. It's a local convenience store. But they don't always know the consequences of what happens. And so communications is a big piece of what we work on. Data management, getting information to the state animal health officials so that they know what's been happening on these operations. We talked about managed movement. We'll talk a little bit more about that. And then this is something that the steering committee really focused on, is they said, well, okay, we understand if we get into a widespread, a type 4 outbreak, we're not going to necessarily depopulate all of our feedlots. How do we manage through that? That's a big question. And so that's another topic that our secure beef supply is looking at. So from the biosecurity standpoint, a lot of different things are in development. The checklist that you all heard about this morning that USDA created for the poultry industry, we're doing the same exact thing for beef, dairy, and swine. We'd already worked on some biosecurity performance standards. What does it really take to get cattle off of a feed yard to processing? Those will be incorporated. And then the biocontainment. What if that feed yard goes positive? What does that look like? So again, all of these documents are in development. I think the biggest take home is, depending on the size of farm, there might be a multi-species operation out there. What if and this question got posed to us from our partners to the east, they said, well, we've got an operation that has 4,000 head of broilers, and behind the broiler operation is a 1,100 cow dairy. What happens if our broilers go positive with HPAI and the milk truck needs to come through there, and they're fourth on a pickup of 6 farms. How do we continue to move milk? It's not a susceptible species, but it's on a farm, that's being depopulated, decontaminated in that. And so when we really looked at the biosecurity recommendations, we're making sure internally, we're blessed that a lot of the team is at Iowa State working on secure beef, secure pork, and secure dairy, such that there's not a different message out there, right? You may have, and this happens in Iowa, we've got cattle and hogs on the same farm, right? We have dairy and hogs. And so we want to make sure that the producers are getting the same message. They're understanding these concepts. Got some biosecurity posters. I've got them up front if anybody wants to take a peek at them through funding from USDA, APHIS, in partnership with National Milk Producers Federation, National Cattlemen's Beef Association, and the American Association of Bovine Practitioners. We created these. There are 3 different posters. So visitors with cattle contact, visitors without, and then general farm activities that have to happen every day. They're available in English and Spanish on our website, and I just got an email from our team. They're working on making them part of our homepage. So if you go to cfsph.iastate.edu, you'll be able to find them. But again, it's getting that consistent message out. All right, next topic is surveillance. So we've got training materials in development for both farm personnel to look for lesions. Again, this is in an outbreak situation, and for plant personnel to become part of that team, right? Because we're more animals commingled than at a processing plant. When we talk about Seneca Valley virus in pigs, they're finding it at processing plants. And so we're working on the training materials for cattle health monitors that'll be on farm, as well as those ante and postmortem inspectors, not just the veterinarians, but some of the plant personnel. So our team is developing materials there as well. North American Meat Institute is forming task forces, again, across the sectors to make sure that we're addressing the issues of concern, because they have to want to accept the product, right? That's kind of, the farmers can do what they want, but if they don't have a market, we need to make sure that those processors and packers are on board with that. What you see pictured here is what's a foot and mouth disease pocket guide of cattle. There's also one of swine, and my colleague, I'll probably talk a little bit about that. But basically it's following cattle lesions in the mouth and in the feet throughout an infection. So we got these images from Plum Island. Again, this was a USDA-funded project, but it's aimed at helping people recognize. We don't want them to be diagnosticians, but we want them to be able to recognize something is wrong. So again, part of the surveillance package. Managed movement is another one of the working groups. So there's a draft document out that our colleagues at K-State have worked very hard on. So we're putting the final touches on that, and it will be available. But it's at the beginning of an outbreak, you've got all these cattle on the road. We understand stop movement is going to happen from that control area, right? We've got to be able to get our arms around it. But what do you do with all these cattle en route? So this document talks about some of those options. And then restarting movement. This is a question producers ask all the time: when can I move again? When can I move again, right? We deal with this in TB. So this is, we have lessons we can learn from other diseases, but contingency planning is going to be essential. So we're working on projects related to that. And then finally, management of an infected premises. So if an outbreak is too large to depopulate, we've got some draft documents that have been circulated. The beef one's been through a couple of reviews because there's so many things to think about. Well-being and best management practices. These animals are going to be painful. They're going to have mouth lesions. They're not going to want to eat. They're going to have foot lesions. They're going to be sore. How do we help them regain herd health and productivity, minimizing the economic losses? Because indemnity is paid for animals that are depopulated. That first sentence says it's too large to depopulate. There's not an indemnity check for these farms. They're going to lose production value. So how can we be thinking about some of these things ahead of time? So a whole series of websites, some of them were already revealed to you, and my colleagues will be talking about secure pork and secure milk. But again, more information is available